Hello, and welcome to another live broadcast with MedStar Health. My name is Mishan Bowman, and today I'm joined by medical oncologist and hematologist, Dr. Shweta Kurian. Today we're going to be talking about the importance of getting a second opinion if you or a loved one has been unfortunately diagnosed with breast cancer. With this being Breast Cancer Awareness Month, we empathize with the millions who have been affected by this disease, and we hope that this discussion provides some help and much needed hope and answers to your questions. So if you'd like to learn more, stick around. Give us a like to let us know that you're watching, and ask us your questions in the comments. We're going to take some time to answer those as well. So welcome, Dr. Kurian. Thank you so much for taking the time to speak with us today.
Thank you for having me.
Thank you. Before we begin, could you tell us a little bit about yourself and the work that you do here at MedStar Health?
So I'm Shweta Kurian. I am one of the medical oncologists and hematologists. I see patients with breast cancer and lots of other types of cancers, but mainly breast cancer. I also specialize in hematology, so I do see other blood-related disorders. I see, all adult patients mostly. We're involved in caring for patients with cancer, blood-related disorders. We treat them here with chemotherapy, and we also have clinical trials going on, so we do help our patients enroll onto trials to see if there are future treatments that would be helpful and beneficial for them.
Thank you very much, Dr. Kurian. So let's get into our questions. So first off, if someone has been diagnosed with breast cancer, is it helpful to get a second opinion, and if so, why?
So a diagnosis of cancer is never easy, ever. Whether it's a small tumor or a large tumor, or whatever is going on, it's always anxiety provoking.
Yes.
When you get an opinion from one physician, it depends whether what you hear from them, do you think that's appropriate, what you're finding, it's okay or not. And sometimes it just makes it easier if you hear the same information from another physician. It tells you that everybody has reached on the same diagnosis and they are giving you the same treatment options. So yes, second opinions help take that anxiety away, because it's never easy to understand what I'm getting. Is it right for me, not right for me, or if there are any other options that may be right or appropriate in my care. In this day and age, I don't think anybody says no to second opinions. So I think it's appropriate if you think that is the right thing for you to get a second opinion.
Absolutely. Thank you. So how easy is it to get a second opinion?
So I know for MedStar here, we have a policy that we get our patients, if you give a call that you need a second opinion or you need an opinion for any cancer, we try to get you in within a day or two's time. So
that's quick.
And if you call, we make sure that appointment happens in a reasonable frame of time. I think once you have a diagnosis of cancer, you want things lined up to happen in a certain frame of time so the care is not delayed. Sometimes it also depends on your insurance, which physician you're going to choose, where you're going to go. So you may have to work with them, but I think time is of the essence. You need to find someone who can get in to see you in a reasonable frame of time. We here at MedStar are able to provide you with in-office appointments, tele-appointments, e-visit appointments. That means appointments on the phone or via e-visits, or if you would like to come in, it's open. We do want you to come in and get that appointment. So whichever way it is easy for you to come in and get that appointment or get that opinion, we are able to provide you with that in a reasonable frame of time.
That's good. You have plenty of options out there.
Yes.
So could it upset a patient's doctor if they ever tell them that they want a second opinion?
So I can tell you from my personal opinion that I don't think it ever upsets me if a patient comes and says that I want a second opinion. In this day and age, we know that all patients would consider that as one of their options. If me or my loved one is diagnosed with a cancer, I would consider getting a second opinion, because that's how it is in this day and age. I don't think physicians are offended when you tell them that we want a second opinion, or at least they shouldn't. But if you think that is the right way for you, that you need a second opinion, I think it's appropriate to look for a second opinion.
Thank you. So if breast cancer runs in a patient's family, but their doctor doesn't see the need, at least for genetic testing, is that an instance where the patient should also seek a second opinion?
They could. I think there has to be a dialogue with your physician too, saying, hey, these are the things that are happening. Do you think talking to a genetic counselor might be helpful? If you don't think you're getting a good advice, or you want more answers than what you are getting from your physician, it's always appropriate to reach out for another opinion. Yes, and that would be appropriate because some of the genetic cancers, if you are concerned that the cancers in your family are probably related to a gene, you would require testing. You would require testing for other family members, and that is a very detailed process. Someone who is an expert in there, who knows which cancers are related, which particular gene testing needs to be done, and whether your insurance is going to cover that testing, how to go about getting that testing. I think it's important to meet with someone who has the expertise there.
Great. So when it comes to cancer, of course, many treatments can be time sensitive. So could getting a second opinion delay treatment?
I think, as we said, when we get a call that a person needs to come in for a second opinion, we do take into consideration the time frames they need to come in. If it's within a day or two's time, I don't think that delays your care. What I do suggest is if the other physician has recommended some testing or procedures to be done, that you schedule those procedures and then continue looking for an opinion for another physician so the care is not delayed. If there are some other options that the new place that you've sought a second opinion from is offering, you could have a discussion with your other physician, depending on where you would like to continue your care with, that these are certain things that need to be done more than what is happening. They can be incorporated in your care. At the end of the day, what is important is your care. It's the patient's care is paramount. If there are things both the physicians can do to bring the best care in terms of caring for your cancer, I think that is the main point of getting a second opinion.
Thank you. So if you're just joining us either live or watching the replay, thank you very much for tuning in. I'm here today with medical oncologist and hematologist, Dr. Shweta Kurian, discussing the importance of getting a second opinion if you've been diagnosed with breast cancer. We have more to talk about, so keep watching. Give us a like to let us know you're watching, and ask us your questions. We're going to take some time to answer those as well. So back to our questions. How should a patient find a doctor to provide a second opinion? What's the most effective way?
I think a lot of people do a Google search looking for areas for cancer centers in your area. I think the first thing should be to look, is there a cancer center in your area? There are physicians practicing as community physicians. There are other physicians who are affiliated with a cancer center. There are physicians affiliated with a university. So sometimes it depends on what level of care you're looking for, how far you're willing to travel, because a university setting may not be available close to where you are. Mm-hmm. That doesn't mean you cannot go for a second opinion there. You could still go for an opinion there and continue with your care locally with the place you would wish to continue your care with. Your local physician could work in conjunction with the other physician to make sure you have the best care available where you are living, close to you. Other times, some of the things that are available in certain cancer centers, like clinical trials or university settings, may not be available at the local place you went in for your first opinion. So you may have to then decide where you would like to take your care. Mm-hmm. And how, in most of the places, as I said, if we are able to accommodate you coming in for a second opinion in 2 days' time, we should be able to provide that care reasonably to you over a reasonable period of time. Looking at your particular diagnosis, what type of cancer you have, even in breast cancer, what type of cancer, what receptors, what available options for treatment are there, and even looking at whether we should look into clinical trials available up front when you're coming in for treatment. It helps direct your care.
Thank you. So if a patient's insurance company requires a second opinion to approve their treatment plan, why is that?
I think it's because they want to make sure that the treatment that is recommended is the guided or the standard of care. And there are, oncology or cancer care is it's evolving. Every day new medications are being approved for treatment of different types of cancer, including breast cancer. So some of the treatments have shown improvement in survival, and research data is available, but insurance are still getting on to that and kind of getting those medications enrolled in their formulary of approved drugs. But physicians have already recommended, in certain cases, they would say, okay, we're not sure why this physician is recommending this. Could we get a second opinion? And if the other physician also says that, yes, there is data available for this particular thing, insurance will approve those treatments certain times. It may not be the case all the time, but many a times it is that way. It also helps the insurances to feel comfortable, as I said, about standard of care. Treatment for breast cancer is very standardized most of the time in terms of staging, when somebody gets chemo before surgery, after surgery, and what treatments are used. And so if something is being recommended to the patient and they want to ensure this is the standard guideline, they might ask another physician to come in to give their opinion too.
So if there's any uncertainty about the type of breast cancer a patient has, should they get another opinion? Is that another instance?
Absolutely. Anytime there is an uncertainty about the type of cancer, pathology, I think it's very, very advisable to have another set of eyes look at the case and see what's going on. Most of the time when you have trained pathologists that look at the microscope and see the cancer cells under there, they do their testing, they're able to tell what type of cancer it is. Other times, if the cancer cells look very different from their normal cells, it's hard to judge just by looking at them what type of cancer they're going to be. They would require additional testing, an additional set of eyes, more expertise sometimes to decide, okay, this is what I think. So getting to have another experienced physician go over things when the diagnosis is in question is always a good idea. And we as physicians here, even if we have any questions about the diagnosis we make or any questions about the treatment options we give, we do reach out to our colleagues at university settings, ask them to review the slides and give us their opinion about what they see in terms of pathology. So we are not making this discussion or this treatment option based on ourselves, just one person's diagnosis. There is a team of people involved when we say that this is the treatment option, this is what we are going to do for you. Having said that, going to for your treatment any place, I want you to understand, especially when you come to a cancer center, cancer treatment is not a treatment where one person decides one thing and that is all that happens. Your care is dependent on so many moving parts and so many physicians giving their discussion or their input about how your care should be, because not one physician can care for their cancer alone. You need input from surgical oncologists, breast surgeons who take care of the surgical part of it. You need radiation oncologists who need to be there. You need radiologists who read the scans and say where the tumor is located, how far you need to go about it, if the lymph nodes are involved or not. And you need input from pathologists, which are who read the biopsy results and inform us of what type of cancer it is. So it's not a decision about treatment made by just one person. There's a team of people involved in caring for the patient.
That's good to know. It's truly a team effort.
That is correct.
Yeah. So if a patient ever doubts the accuracy of their diagnosis, is that another instance where they should get a second opinion?
Absolutely. Absolutely, because you want, if you get the same opinion from other place, you feel a little more comfortable. It's easy when things go as planned. You got chemo, the tumor shrinks, you did well after surgery, everything well and planned, and everybody feels better. But let's say you got chemo and the tumor keeps increasing through chemo. You start doubting, did I get the right treatment? Is it the right thing that I did? It's appropriate to seek an opinion in that scenario and if the other physician says whatever is being done is fine, you just happen to have a more aggressive kind of cancer that's growing through the treatment, you'll feel a lot more comfortable about it, because then you're not trying to say, I did not get the right treatment and that's why my tumor grew. Instead, you have another physician who tells you that, hey, what you had was more aggressive, was something that even with the correct treatment didn't do what it was supposed to do. So you'll feel more comfortable with the team that's caring for you.
Great, great. We got some feedback and some questions from social media, so let's take some time to answer those.
Sure.
We have a comment from Karen. Thank you much for tuning in and sharing your feedback. She says, I love the Live Now segments from MedStar Health. So thank you very much for sharing your great positive feedback. We have a question from Amy as well. Thank you very much for tuning in and sharing this question. She asks, what's the best way to approach your physician about this topic if you feel uncomfortable about it?
So, you could say that I would like a second opinion, and it's not that I'm doubting, it's just that I need to know, I need to feel if there are any other treatment options or anything else available someplace. I would like to explore those options and see what's there for now or maybe for the future. You could bring it up in that scenario. It's always difficult because we feel that in some way we might offend the physician, but I want you to feel comfortable about it, because as I said, your health is paramount. You need to feel comfortable with whatever is going on in your life, and just having an honest discussion with your physician and saying, it's not it's just that I need to understand more about this. If I hear another opinion, I'd feel more comfortable. So I will, and if you are comfortable with that physician, you could even say you will continue your care here, and whichever way it makes you feel comfortable to have that discussion with the physician. But all I would say is, having a discussion, it should be an open thing with your physician where you say, I want to seek a second opinion just because I want to be more comfortable with this diagnosis. It's not a reflection on how the physician handled or took care of things. So, and I think most physicians in this day and age understand that. I don't think anybody, if you ask that I'm going for a second opinion, will say why or no, you shouldn't. They would actively support it. I mean, I do it all the time for my patients, say I can expedite it for you. If you need to go to Hopkins or Maryland, I can suggest physicians even reach out to them so you can get the opinion you need.
Thank you very much. We have another question. Thank you again for sharing those, and keep them coming if you like. So this person asks, are clinical trials and genetic testing available at the Cancer Center here at MedStar Franklin Square?
Yes, absolutely. We have a genetic counselor, and she's able to meet with you, discuss your whole family history, decide whether genetic testing is appropriate for you, and then they even suggest which family member need to be tested, because depending on the type of cancer, some of the patients may be candidates, or sometimes it's the family member who is a candidate for genetic testing. So we try to, or the genetic counselor tries to go over the history and then kind of figures out who is the best person to be tested. So yes, it is available at Franklin Square and at other MedStar facilities. Clinical trials are offered on all MedStar facilities. We may have some cancers may have more trials than the others. Okay. I think breast cancer has a very robust clinical trial program at Franklin Square, and it's offered at all MedStar facilities. So if you are interested in a clinical trial, by all means reach out to the MedStar facility. We'll have to go through your case file to see what type of cancer and what would be an appropriate trial for you. So generally you want to reach out before you start any treatment if you are interested in trials, because it depends on, some of the trials are dependent on what stage of treatment you're in. So, but that doesn't mean, depending on any part of your treatment, if you are interested in trials, it'll be worthwhile to reach out to the MedStar facility and ask for an opinion or a second opinion to come in.
Great, great. One other question. So, of course, safety right now is especially a priority for everyone. So what should patients know about how we're keeping patients safe during this time?
So I think all of us are worried about safety at this time. Mm-hmm. And the fact that I'm sitting and talking with you and both of us have masks on speaks a lot. I think everyone takes everybody's safety very, very seriously. We are as concerned about you as we are concerned about ourselves. So we make sure the places we work are clean, everybody cleans their hands. There are alcohol dispensers everywhere. Any physician contacts, we have masks as well as shields on. And so we do ensure that people coming in are safe when they come in. People who come to work are healthy when they come in. So we provide a safe environment for the patients. And I think we are seeing a lot of patients coming in now. I know in the beginning, all of us were trying to learn how to tackle this virus.
Absolutely.
But now, 7 months into this, I think we are more comfortable. We've seen more and more patients coming in and not having problems, not having issues in the workplace or with our patients who have come in. Makes us feel more comfortable that whatever we're doing is helping, it's working, and it's keeping our patients and our associates safe.
Great, that's awesome to hear. So Dr. Kurian, do you have any other words, any other message for our viewers today?
Well, all I want to say is if you're ever diagnosed with cancer, breast cancer, I think it is very important that you understand what your cancer is, how it's going to be treated, what your options are in terms of treatment. Because you are your best advocate. And I think that is the most important thing for anybody who ever develops cancer. So if that means you have to get a second opinion, I think you should go out and do that. It's not about people feeling bad or physicians getting upset. It's about your health and your life forward. So you take charge and you do what you need to do to get the best opinion for you. If that means going out and finding a physician who gives you another advice, then you take the appropriate steps. We are here to help you with this. We will, if you call us that you need a second opinion for your breast cancer or any cancer, we will make sure that you get in within 2 days' time, and we expedite things for you so you get the best care possible. And if we think you need another opinion from another place, we will make sure that we get you in another place to get that opinion for you.
Thank you very much. You are your best advocate. That's one great point to remember. So thank you very much, Dr. Kurian, for joining us today. We really appreciate your time. And thank you very much to all of our viewers for tuning in and sharing your comments and questions. For more information or to schedule an appointment with Dr. Kurian, please call 443-777-7147. We'll see you next time.